Human sexuality and sexual activity is very psychological. In order to understand how human sexuality is connected to psychology, we must first understand who we are as sexual beings and address any sexual problems we may have. Alfred Kinsey was a professor and biologist that created the Kinsey Reports, which included information about people and their sex lives. Although his work was sufficient, it lacked knowledge about what happens to us physically when we engage in sexual behavior and what people should do if they experience certain sexual problems. Psychologists involved with the physiology of human sexual responses William Masters and Virginia Johnson. The goal of their research was to create an understanding of the full expression of ourselves as sexual beings, successful treatment of sexual problems, and our sexual functioning as humans. The theory they proposed was that to understand human sexuality, we must study actual sexual behaviors as they occur in response to sexual stimulation rather than record what people perceive or believe their sexual experiences to be. When they began their research, Master and Johnson used prostitutes as participants in their study, but their attempt to use prostitutes proved to be insufficient, so they conducted an experiment in which they observed certain sexual behaviors, such as manual and mechanical manipulation and intercourse. They observed and recorded the sexual responses to the sexual activity and discovered many different results. One of the great contributions made by Masters and Johnson was dispelling sexual myths such as penis size and a woman's sexual enjoyment, but one of their most influential findings was the human sexual response cycle. The human sexual response cycle consists of 4 different stages. The stages are excitement, plateau, orgasm, and resolution. The excitement stage consists of physical arousal such as erection in penis and vaginal lubrication. The plateau stage is when muscle tension and blood pressure increases within both men and women's sexual organs. The orgasm stage consists of contractions within the pelvic area and the release of vaginal fluids, and ejaculation occurs. The final stage is resolution, which consists of the sexual organs and their sensitive areas returning to their unaroused state within 1 minute. One critic of Masters and Johnson's sexual response cycle is Helen Singer Kaplan. She proposed a 3-stage model that includes desire, engorgement of genitals, and muscle contractions, which is orgasms. She believed that an analysis of sexual response should begin with sexual desire before any sexual stimulation begins. Her focus on the desire aspect of sexuality leads to another main criticism of their work, that their research lacks attention to psychological factors. The main goal of Masters and Johnson's research was to address problems of sexual inadequacy and the physiology of human sexual response. Although we still have a lot more to learn about sexual response, we can thank Masters and Johnson for their work in allowing people to understand the physical processes involved in human sexual pleasure and response.